Dollemocracy. Facing down pessimistic politics with realistic optimism.
So last episode, I think toward the end of the show, we ended talking about how Idaho is dissolving their Maternal Mortality Review Committee.
Right.
And that is a committee of professionals that look at the deaths in the state and figure out what happened and what needs to change to prevent it from happening again. And so naturally in Idaho, they said, we don't really need this.
Yeah. So they've drastically, maybe in the most radical way, one of the most radical states in the union related to abortion, putting women's lives at risk, putting pregnancies at risk, putting not just people seeking abortions, but people seeking to have kids are also at risk from this. And then they dismantle the Maternity Mortality Review Board because they want to cover up the ultimate consequences of what their actions are.
Yeah, I think the argument was that it wasn't financially sound
or
something. The investment in it wasn't worth the return.
Yeah, they're being good stewards of the taxpayer dollars.
Yeah. So, and during that conversation, you brought up the maternal mortality rates for Black women, which are much higher than for white women. And
orders of magnitude more.
Yes. Yeah. And I happened upon this news package about a California hospital that is actually now facing an investigation over its treatment of Black women in childbirth.
Tonight, the LA Times reporting a California hospital is facing a federal civil rights investigation for the way it treats Black women giving birth there.
My wife would be here with her boys if it wasn't for the color of her skin.
The death of 39-year-old Kira Johnson initiating the scrutiny after her husband filed a civil rights lawsuit against Cedars-Sinai Medical Center. It was later settled. Kira and her husband Charles, already parents to one son, a picture-perfect family, when she died after a scheduled C-section delivery of their second child in 2016.
After allowing my wife to bleed and suffer needlessly, while my family and myself begged and pleaded for them to simply just treat her with dignity and respect.
The case bolstered by this video deposition from Angelique Washington, a former surgical technician at Cedars-Sinai who was in Kira's operating room.
The room started to look like a murder scene, a crime scene. It started blood everywhere. I knew it didn't feel good.
The LA Times reporting on the investigation after reviewing a letter sent to Kira's husband Charles from the Federal Department of Health and Human Services, stating the department is reviewing the allegations. NBC News also obtaining the letter that says in part, the HHS Office of Civil Rights, quote, is aware of allegations that Black women are provided a standard of care below what is provided to other women who are not Black when receiving health care services related to labor and delivery. HHS confirming the investigation to the LA Times. NBC News has not heard back from the department. The CDC says in 2021, the maternal mortality rate for Black women was 69.9 deaths per 100,000 live births. That's 2.6 times the rate for white women.
It has to do with racism in society, racism in healthcare, bias amongst healthcare professionals. So we're seeing a disproportionate number of deaths.
A Cedars-Sinai spokesperson declining to comment on the investigation, but telling NBC News, Cedars-Sinai clinicians, leaders, and researchers have long been concerned with national disparities in Black maternal health, and we are proud of the work we've done and continue to do to address these issues. Kira's husband also filing a lawsuit against her doctor for gross negligence, receiving a $1 million settlement, and filing an additional suit against the hospital that was also settled. Johnson vowing that the pain his family has endured will shed light on the devastating consequences.
Kira's legacy will be that this is no longer allowed to happen anyplace.
So I wonder how much of this biased treatment of Black women in pregnancy is almost a carryover of what they find in research on the difference between how white girls and Black girls are treated, in school settings when they're young, where
I wrote that down.
Where Black girls experience this kind of adultification bias.
I wrote Black children seen as more mature, I wrote.
Yeah.
Yeah.
Yeah, less innocent, less in need of nurturing, less in need of protection. That's what that research finds.
More aware and deciding what they're doing, like more agency almost.
Yeah,
like a child, they're just a kid. They don't know what they're doing. But if you're a black kid, you know exactly what you're fucking doing, and you need to be punished for it.
Yeah, and we should be clear that that's not true. That's just the bias. Like, that's the adult attitude that they find in research when looking at the differences between how white girls and black girls are perceived.
Not just perceived, but also and then treated, because detention and out of school and in school and expulsions from school, it is a radical number more than what white children receive, especially what black girls receive.
Right.
So the other thing about, I mean, this is terrible all the way around in every aspect. There are doctors, people who have gone through and graduated medical school, gone through residency. They're full-on doctors who believe that black people have thicker skin, physiologically thicker than white people. Not a metaphor about, oh, thick-skinned. Like thicker skin, like a needle is harder to break the skin. Like Superman shit. They're oftentimes black patients are perceived, if they're in pain, they're not believed because there's this racist idea that it's drug-seeking behavior. All of these things in this medical context are terrible because, not just because racism, but because people lose their lives over the mistreatment. Like this woman we're talking about. Like hundreds of women all across the country who are just have a standard pregnancy, no complications, and then die because of medical neglect that is rooted in racism. Yeah.
Yeah. Well, and we expect our medical professionals to be better than this, right? They're educated, they're trained. We would expect more from them. But unless this is explicitly in their training, then it's not something that they are able to get a grasp on, able to overcome, able to unlearn and relearn. And so, yeah, it's terrible.